Hello, this is Siddharth Tambar from Chicago Arthritis and Regenerative Medicine. One of the keys to trying to get the best possible outcome for your patients is having a really diligent and focused process where every step of the way you're constantly reassessing what you're doing. As an example, I have a patient for whom I am treating her shoulder. She's someone who's done really well with BMAC, derived stem cells for her knees, and now she's also developed some rotator cuff tendinitis. On imaging several months ago, when she originally presented again, she had some mild rotator cuff tendinopathy and had already tried physical therapy, so we were escalating the platelet-rich plasma. She was scheduled to come in today, but called in yesterday saying she's doing a lot worse. And so reevaluated her at that time, looked at her shoulder under ultrasound, and it turned out she'd actually developed calcific tendinitis. She'd had some significant calcification in the insertion of the tendon of the rotator cuff. So rather than proceeding with platelet-rich plasma, which would aggravate that problem, what we ended up doing was what's called percutaneous needle barbotage, which essentially means under ultrasound guidance, identifying the calcification within the tendon, taking a needle to basically break up the calcification and wash it out with saline, and then let it drain out. What you see when you do that is the milky calcium come out, and it essentially loosens up what's causing inflammation with the tendon at that moment. In her case, this helped out a lot. What's interesting is that in most similar cases, the traditional approach is to then inject a high dose of corticosteroid into the tendon. The idea being, can you reduce any inflammation that occurs after that procedure? The concern I have, and for anyone that does regenerative medicine, is that injecting a high dose of steroid into a tendon will damage the tendon. So instead what we did was inject some numbing medication, which is okay for the tendon, and then also a very low dose of a steroid, a millionth the dose of what's typically used, which is not toxic to the tendon cells. So she came back in today, a day later. Her shoulder's about 40% better just from needling out the calcium, and the plan will be to reassess her in a couple of weeks to make sure with some physical therapy and just some passive range of motion, her pain starts to reduce. Eventually at some point we'll go back in to do platelet-rich plasma, but at this point we are taking a little bit of a pause in that, and I think it really emphasizes the approach that works to patient care, which is assess, make a plan, treat, but every single step of the way, reassess and replan and try to get the best outcome, try to steer your patient into the best possible outcome for them. And then of course, understanding how orthobiologics work and when to use them and when not to use them. Thank you for your time. Live well. Bye-bye.